Heart valve repair or replacement, percutaneous. Normally, the heart valves open and close to keep blood moving in the right direction through the heart. Disease or defects in the heart valves can disrupt this normal blood flow, causing symptoms such as tiredness, heart palpitations, and trouble breathing. These symptoms come on gradually. In some cases, a damaged heart valve needs to be repaired or replaced. Many times, this can be done without the need for open heart surgery. Instead, your healthcare providers may be able to repair or replace your heart valve using a minimally invasive procedure. These are called percutaneous or transcatheter procedures. Reasons for the procedure. The most common reason people have heart valve procedures is for a leaking or narrowed heart valve. These conditions make the heart work harder to get blood into the heart or out of the body. When a heart valve is leaky, it is called regurgitation. The heart valve doesn't close completely, and some blood flows backward through the valve. When a heart valve is too narrow, it is called stenosis. The valve opening can become narrow and stiff, limiting the flow of blood into or out of the heart chambers. If you need heart valve repair or replacement, your healthcare provider will discuss treatments with you. He or she will tell you which treatment options are best for you based on your individual case. Before the procedure. Before your procedure, you will have certain tests to fully evaluate your condition. These tests may include transesophageal echocardiography. For this test, a thin flexible tube will be guided down your throat and into your esophagus. This is a type of imaging test that uses sound waves to create moving pictures of the heart and heart valves. You may also have blood, urine, or other lab tests. Your healthcare provider will also want to know about all of the medications you take, including prescription and over-the-counter types. During the procedure. The exact procedure you undergo for a damaged valve depends on the nature and extent of your damage. You will first receive anesthesia, so you will not feel any pain. The type and amount of anesthesia you receive depends on the procedure. If your valve is too narrow, your doctor may do a procedure called a balloon valvuloplasty. In some cases, the doctor may also do a transcatheter valve replacement. This is usually done for the aortic valve. Your doctor will insert a balloon catheter into a blood vessel. He or she will guide it to the damaged heart valve. Next, the doctor will expand the balloon inside your valve. This stretches the valve open. If the doctor is replacing your aortic valve, he or she will put the new valve on the catheter. The doctor will then guide the catheter back to the damaged valve. He or she will expand the new valve into place. If your mitral valve is leaking, your doctor may recommend repairs using a transcatheter approach. Your doctor will put a catheter into one of your blood vessels. The catheter will have a special clip device attached. Your doctor will guide the clip on the catheter to the leaking mitral valve. The clip will grasp the two sides of the mitral valve and close. This creates a double opening of the mitral valve. The clip still allows blood to flow on either side of it, but it greatly reduces the amount of leaking. After your healthcare provider completes the procedure, he or she will close the incisions. After the procedure. The length of your hospital stay will depend on your overall condition after surgery. For the first few days, you may be in intensive care. Once your healthcare providers feel that you have recovered enough to go home, follow all your instructions for medications, pain control, diet, activity, and wound care. Make sure to keep all your follow-up appointments. The outlook after endovascular heart valve procedures is very good, although everyone's situation is different. There is a less favorable outlook if open heart surgery is required. If you have an artificial valve, you will need to take an anticoagulant, blood thinner, for the rest of your life to reduce the risk of a blood clot forming in the valve, which can break free, causing a stroke or other problems. Before you have any dental procedures, always tell your dentist that you have had valve repair or surgery. Your healthcare provider may give you antibiotics to take before your dental work to prevent infection of an artificial valve. Overall, you should have few restrictions on your activities within a short period after the surgery. Things to remember. Endovascular heart valve repair or replacement is done using a catheter rather than a large chest incision. If your heart valve is replaced, you will need anticoagulant medication for the rest of your life. Leaking or narrowed heart valves may be treated using endovascular techniques. What we have learned. Endovascular repair of a heart valve doesn't require open heart surgery. True or false? The answer is true. Endovascular repair uses a catheter thread through a blood vessel to repair a valve. Having a heart valve replacement requires that you take a blood thinner for the rest of your life. True or false? The answer is true. This medicine lowers the risk of a blood clot forming in the valve.